It's really amazing what's happening in thyroid cancer right now. In fact, at an international level, thyroid cancer is taking on an epidemic. If you look hard enough to find thyroid cancer, you will find it. However, the majority of them will be benign, a subset of which could be thyroid cancers. Any neck mass that persists, whether it be in the central neck or on the outside of the neck, is always of concern. Obviously, children often have enlarged lymph nodes, and they usually go away. People have unusual weight gain or loss, anxiety, racing of their heart. Those are all subtle impressions of a thyroid gland disorder, although in many cases it has nothing to do with the thyroid gland, but they're certainly worth sorting out. There are clear risk factors for thyroid cancer that include a family history, but the biggest one, of course, is radiation. And it's good for the public to know that diagnostic imaging studies like CT scans are associated with radiation, and one has to think twice when you have a relatively young patient, say under 30 years of age, and a CT is recommended. At Yale Medicine, our imagers have specialized in developing techniques to use less radiation per scan so that we minimize the risk of exposure. The treatment of thyroid cancers, for the most part, involves 3 phases. The first is surgical treatment, that is to remove the cancer and/or associated lymph nodes. The second is to consider radioactive iodine therapy for subsets of thyroid cancer. And the third is lifelong hormone replacement to suppress a pituitary hormone called TSH. The vast majority of patients will not have recurrence and will certainly not have a shortened lifespan when treated appropriately. As in any operation, there are clear risk factors, and they involve structures that can be injured at the time of surgery, like the recurrent nerves, the main nerves to the vocal cords, or the parathyroid gland. Here at Yale Medicine, we believe so strongly that there's a general overtreatment of thyroid cancers that we've established a new clinical trial in which we're actually not operating on a subset of patients. We're treating the thyroid itself with a small injection of alcohol to kill the tumor, but leave the thyroid gland alone. It's the beauty of being at Yale Medicine, where we can afford to have the resources that are required and the expertise around us to do these kind of procedures. Our vision is that every patient and their families deserves the best care possible. Some diseases are not curable, but what patients have a right to expect is that you empathize and you care and you do everything humanly possible to deliver the best care possible for each one of them. I'm Dr. Robert Eutelsman, the Chair of Surgery at Yale Medicine.